God, no, Nestle.
Okay. Welcome to the Healthcare Rule Breaker Studio. Today we are with the fabulous Quisha Umemba. She's a go-to public health expert, storyteller, freelance writer, and change maker on a mission to ignite conversations that matter. Quisha Umemba is a registered nurse, public health practitioner, nonprofit founder, social entrepreneur, and author. As a nurse with a passion for community well being, Quisha embarked on a journey to bridge the gap between healthcare systems and the people they serve. From bustling hospital wards to community clinics, she witnessed firsthand the power of preventative care and education in transforming lives. Through Remember Health, her brainchild dedicated to empowering public health professionals and organizations, she has pioneered innovative training programs that empower individuals with practical skills for real world impact. Whether it's shedding light on pressing public health issues or empowering individuals to harness their full potential, Quisha's goal is to spark change and inspire action. Quisha is always eager to write or speak about topics that help to amplify voices, ignite conversations, and create a healthier, more equitable world for all. Quisha, welcome to the Healthcare Rule Breaker Studio. We're so excited to hear about you and your work and everything that you embody. So, with that, I would love to just get into starting the conversation with a little bit about you, your background, and kind of what led you on this journey of entrepreneurship.
Well, hello, ladies. Good morning. Thank you for having me. I'm really excited to be talking with you all today. So, yes, I'm Quisha Umemba, and I am a registered nurse, although I tend to forget that. I've been in public health now for the same amount of time that I've been a nurse. And so I tend to lead with public health consultant first, but I'm a nurse. I'm a nurse at heart. I'm just like you ladies. My goal when I went into nursing was to help people and to have an impact on their lives and on communities. And I realized very quickly after a few years on the floor at the bedside that I just was treating and streeting. And that wasn't the type of impact that I wanted to make. A good friend of mine, who was also a supervisor at the time, our endocrinologist for the diabetes endocrinology clinics at Quisha, I really think a public health degree would suit you well, because I was starting to get into diabetes education and really help in health coaching and really trying to help my clients figure out how to do life and how to do diabetes outside of the hospital walls. And so that's when I learned about the social determinants of health, and what really impacts our health is the environment that we live in, the things that are going on in our lives. And so I went and got a master's in public health. And I like to say I'm the nurse that got bit by the public health bug. I haven't looked back. Now, public health, while as much as I love it, and I do, comes with its own challenges. And just like healthcare, it's laden with a lot of red tape and bureaucracy and levels of approval. And when I need something for my staff or for my community or the clients we serve, I tend to be pretty impatient. And so I found myself in positions where I was extremely frustrated that I wasn't able to get the resources or the support or the funding that I needed to implement our initiatives and our programs in a way that I thought would have best suited those that I was serving. Again, that's internal and external to the organization too. And so I got a few years of experience at the local health department level and at the state health department level. My last position was diabetes nurse consultant for the state of Texas. And that's when I found out, oh, consulting is just providing technical assistance based on your expertise. I can do that all day long. I can probably do that on my own. And so I did. I started Umemba Health, which is a management consulting company. I like to say it's public health training, education, and consulting. And 5 years will be December the 1st. I'm really proud about that. Most 45% of businesses don't make it to year 5. And so we're celebrating 5 years of serving public health and healthcare agencies to empower their leadership, to educate their frontline workforce, and in helping expand their community presence. And so that's a little bit in a nutshell. I'm sure we'll get to learn more about me and what I do as the conversation unfolds.
I love hearing your story and your passion around what you're doing. So I'm curious, how do you know what you're doing is being successful out in the world? Because as an entrepreneur, sometimes you're like, am I making the real impact that I'm striving to do? How do you know?
Let me tell you why I'm laughing. And I think my sunlight here around this time, it kind of comes into my face. So I'm laughing because yesterday I graduated from a business accelerator and we had to do a pitch competition. And after, there were three judges, and one of the judges asked me, how do you know your business is successful? How do you know what you're doing is successful? And I hope she's not offended if she comes across this podcast at all. And in my head, I was like, ma'am, did you just not see the financial projections that I showed you over the last 5 years? That's from an entrepreneurial standpoint.
Right.
My financial projections go like this. So that's one measure of success as a businesswoman, right? But I understand the question that you're asking. It's so funny that you said that. No, we survey a lot in my business, not only our students, because we do provide certification courses for community health workers and community health worker instructors, but we also do customer service and customer satisfaction surveys after every project. I also am a researcher. I also stay abreast of current trends. I also go to a lot of conferences and events to see what's going on in the industry, what is needed, what is lacking. I believe in very much filling a need and filling the gap and finding those gaps and serving in those areas. And so, just a good old needs assessment. That's the first thing we do in nursing, right? Is we do our assessment on our client to see how they are and see, what interventions they need. It's no different with my business as well. And so getting that feedback, getting those testimonials, getting those reviews from our clients and our students is always a way to let me know that I'm on the right track. And yeah, so far it's been good. And not to say that every review is, top tier and, every experience is, but you take those experiences that are not at what I consider to be a standard of excellence, which is what I want us to do all the time with every client. And then you adjust. So we're constantly in a state of continuous improvement at Umemba Health for our services and just how we show up. And I think that's probably the best measure is we survey, we learn, we do. We survey, we learn, we do. And it never stops.
It's a never ending. I asked that because you mentioned the consultant thing, and I thought, so many times people pull in consultants and they ask for their help and they show up, and no discredit to them, but many of the people have not lived in the world and have the true real life experience and passion around it, which it's hard to be an entrepreneur. And when you have that passion, it keeps you going, but you really know what you're talking about and doing. You're speaking from real experience. So I just wanted to hear your story about that. And I think it's funny. It struck something recent.
It was so funny because after that pitch, I was like, how do I know? I'm not sure how to answer this question. And I fumbled through it, right? I didn't say that. I fumbled. I made it something, but I remember telling my peers afterwards because they were all like, what kind of question was that? And I thought, oh, it wasn't just me. Okay, great. Anyway, I came in third place, by the way, for that pitch.
Yeah.
Nice. Okay, so I have a question for you. So Quisha, I had the pleasure of hearing you speak at an NBA this past summer and was blown away, which is really what led to the invite for the podcast today. And you talked about your book and how I just want to understand a little bit more about, we have a lot of nurses, they author textbooks and things like that, which is a little bit different than what the kind of book that you authored. So I just wanted to hear about what was your journey for becoming an author? How did you know that was something that you wanted to do, and how did you really kind of put together and come up with the idea of what you wanted to sell in that book?
That's such a great question. Writing a book, I think, is one of those. It's like getting a PhD for me. It's a box I know I'm going to check. I just don't know at what point I'm going to check it. Now I know when I'm going to check the PhD box as soon as these loans as soon as these loans are forgiven, right? But so I was invited to write a chapter of a book before I wrote my book, and it was about nurse entrepreneurship. And so when I wrote that book, because you could write about nurse entrepreneurship or whatever you do all day long. And so when I wrote that chapter and the book came out, I was like, oh, this is it. Like, that was easy. that didn't take long. It's like a 6-month process. And so there were 10 nurses on that project. And I thought, well, I could probably do this with public health professionals because I know quite a few public health consultants. And I'm sure I could get 10 consultants and each person could take a chapter and, we can do the same thing. This is an up and coming field and more people should know about public health consulting, especially after the pandemic. It just kind of, took off. And I got a publisher and we went through the whole process and she said, it's going to be hard for you to recruit people. That's going to be the hardest thing. And I said, no, as many people as I know no, this is going to be so easy. It was the hardest thing to recruit people for that book because you have some people that say, oh, I don't know if I'm the person that should be telling people how to start a business, that imposter syndrome. Yeah. And then you have some people, and this is helping professionals, right? We have to get past this block. I don't know because the name of the book is Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit. And then, some people were, I don't know if I want my business in a book with the word profit on it. Like, what will my customers think? And then some people, just wasn't the right time. It was very quick turnaround. It was a 4-month project, right? And so it was so much harder than I thought. And I got 3 people and it worked out perfectly. I got 3 different types of public health consultants. We all have different subject matter expertise. And so they wrote 3 chapters, which left me with 9 chapters. And I thought, well, this is not what I bargained for because I don't know if I can write 9 chapters. And we ended up going over, and I had to actually pay more because we went over the word count. And my publisher was like, Quisha, you always have plenty to say. So that's how we came about it. And honestly, I looked at it as an opportunity. There are not any books on public health entrepreneurship, or there were not 6 months ago when I launched my book. And so I looked at that opportunity as well to assert myself as the thought leader in the space, right? Not to say that I'm the first that has been doing it and certainly not the last. But I just thought we needed something as public health consultants to share, what it is exactly, the work that we do, the types of clients we serve, and the opportunities that exist for individuals that are interested. You see what I do in my business. You see what my co-authors do as health equity consultants or data analysts, data evaluation consultants. And so it allows the readers hopefully to be able to see themselves and to see what's possible for them as a public health consultant and entrepreneur.
I commend you for pulling it off. I feel inspired, but also terrified because you were like, oh, this was easy. And I'm thinking, I never have written anything and thought that was easy.
Well, it was a chapter,
Right.
I mean, the chapter was easy. They give you, kind of some questions that prompt you to respond to them. So I'm back right in the saddle. So I actually have 2 books. I signed up for 2 books under this publisher. And so I actually am developing the content outline and doing the literature review for the 2nd book now. And this book is for organizations and it's on cultivating the intrapreneurs in the workplace. And so we talked about entrepreneurship a little bit before our call. So I'm probably more excited about that one than I am about the last book, because I always say, if I had the right type, I shouldn't say the right, if I had supervisors and managers that knew how to cultivate me as an entrepreneur and my creativity and my innovation and just my ability to create, it's almost like a need to create and to continuously revise and improve, I'd still be employed. Yeah. But I lacked that freedom and that flexibility to be able to do that. And that's an entrepreneur. So I had to strike out on my own, I think, to suit the industry the way that I feel is best suited.
You're speaking my language in leadership development. I always say delegate the outcome, not the approach. But before, Alyssa, I didn't mean to interrupt you, but I want to know where I can buy this book whenever it comes out, because I really want to read it.
Well, it's going to be on Amazon, just like the first one. And it's going to be on my website, QuishaUmemba.com. So hopefully around January, we'll be able to launch that. It's another 3. I mean, I'll be writing all December. It's going to be a quick turnaround. Yeah.
That's amazing to hear. So the statement that you just made, literally, I feel like every time we interview somebody, somebody says something and I get chills. But I mean, it's exactly that is the reason why I think we're seeing such a big nurse entrepreneur boom, right? Is that everybody has ideas, they want to share them, and the culture of the health system isn't really set up to foster the overarching goals and give people freedom, right? It's very confined and very hierarchical. And I think that is, you just really highlighted that's really a struggle. It's really why we're seeing a lot of turnover and those kinds of things in our organizations, because we've got to give people the ability to care for other people in a way that is meaningful to them. So I think that's such a powerful statement.
Absolutely.
Okay, well, Crystal, do you have anything else you want to add before we ask Quisha our healthcare rule breaker staple question?
Oh, that I'm dying to ask that question.
Okay, Quisha. So, as I shared, we do have one takeaway question that we like to share with all of our listeners. So, if you could break one rule in healthcare, what would it be?
Ooh, because I am the rule breaker. I have been described as rogue before. I do tend to like to ask for forgiveness and not permission.
Oh, we love that.
Absolutely. Wear it with honor too. Some people
What'd you
think
say
so
that again?
bad, but it's like, yes, what a compliment.
Oh wow, that's, you know what? I'm going to stay on this topic of entrepreneurship. So one of the things that I wrote in my book is if I wanted to be a doctor or a lawyer, I would get taught how to run a business. I would get taught how to have a practice. Right? There's some other industries as well, but as a nurse and as a public health professional, there's no tract for that. I'm starting to see it more and more, talking about social entrepreneurship when it comes to public health professionals. But that's one rule I would break. I would add that to the course of study. I think that we live in a world now where we can afford to also educate nurses and public health professionals through a social entrepreneurship tract, where we are still doing the same thing, impacting lives, promoting health equity, taking care of patients, all of that stuff. But outside of the hospital walls, because there's always going to be constraint. There's always going to be issues with policies and how we implement certain things inside of an organization, where when you take one of us who's in business for ourselves, we can bypass a lot of that and get things done so much quicker and more efficient. So I would say that's one rule that I would break if it's something to break, but it's certainly something that I think should be implemented.
Yeah.
I definitely think it's something that needs to be challenged. I've screamed that, even as I have a nurse practitioner degree, and I feel like you're exactly right. They teach our medical doctors how to go out and run their own practice, but that's really not afforded to us when we're going through our NP programs, and it absolutely should be. Because when you talk about a public health crisis, those nurses and nurse practitioners are really who can help break down those silos. So I definitely think that's something that we need to challenge in the future as people are developing curriculum. So that's the call. That's today's message.
Yeah, I could not agree more. I have one regret. It's not really a regret, but if I would do my master's over, I would have gotten an MBA, because I had to be intentional to take HR electives and business electives because it was not part of the core curriculum.
And you know what I would do? I would get the MBA. I would get a marketing degree, honestly.
Ooh.
Let me tell you, the most successful coaches, consultants, etc., are those that have a marketing background, because look at their socials, look at their website, their language, their all of that. Because honestly, as an entrepreneur, your first job is to market your services. Your first job is to be a marketer. Your second job is to then do the services that you're marketing. And so I always say, man, I wish I had gotten a marketing degree.
That was the biggest challenge for me, I think, when I was stepping into the entrepreneur world, was understanding, like, what does it take to market and how do you get people to interact with you as a brand?
Yeah.
And I think that's one of the big things now. Like, Crystal and I were just having this conversation. I was like, we've got to elevate nurse leaders to understand that even inside the hospital, they are building a brand.
Your brand.
Communication style, how you walk the halls, like, you're a brand. People are talking about you. And that is however you carry yourself is your brand. And that is, you've really got to be thinking about it in terms of branding and marketing. And you're
Ooh, that sounds like a good training.
Yeah, she's on it. She's the right girl.
I love it. Love it. Love it.
Well, Quisha, it was absolutely our pleasure to have you on the podcast today. And I thank you so much for the gift of your time and your knowledge and your wise words, because they were well beyond measure. So I just want to say thank you for that. Crystal, any last words?
I'm just excited to get the links to your books and just learn more about what you're putting out there in the world. And again, thank you for your time. It's the most precious thing, and you're so willing to give it to us and share your story. And thank you
Been
for the
my
work you
pleasure.
do.
Been my pleasure. Thank you, ladies.
Absolutely. Quisha, one last thing. You did briefly share where people can find you, but would you just do that again one time?
Yeah. So my public health business is Umemba Health, Umemba. So umembahealth.com and at Umemba Health on all social media platforms. And then if you're interested in public health coaching, you can find me at QuishaUmemba.com and my book at QuishaUmemba.com/book. I'm also at Quisha Umemba on all social media platforms as well.
Well, thank you so much for sharing that. And we do hope that somebody finds you and links up and gets all the resources they need.
Awesome. Thanks so much again.